outstanding to see everyone here in the room today. I don't know that anyone came about this from the direction I did. I'll find out here in a minute. But my name's Steve Tatlow. I've worked with the community partnerships throughout Missouri since about 2004. And community partnerships are nonprofits in the communities around the state, 20 communities, that really work to coordinate existing resources around a number of issues involving children and families. About 2005, a number of the partnerships got involved in the Missouri reentry process, which works with the concept of helping returning offenders coming back from prison become legitimate, tax-paying, contributing members of society. And I've, since about 2006, have been the chair of a local reentry steering team, the Boone County Offender Transition Network in Columbia, and worked with a VISTA project, which is kind of like the Peace Corps, AmeriCorps VISTA, where we put VISTAs in about 14 communities around the state to work kind of from the bottom up, the grassroots, up sort of approach in coordinating resources. We came a long way working in that reentry process. It didn't take me too long to realize that I could be in the reentry business forever. And it would be a good thing to do. In reentry, in addition to helping these folks become contributing members of society, you're preventing new crimes, lessening, future victims. I mean, it's a great cause, but realized, and there's real job security there too, but kind of wanted to approach it from more of a perspective of what if we did business differently in such a way that we tried to put the prisons out of business. How could we prevent this in the first place? And working with a lot of the people that I work with, very broad-based, have ex-offenders in my steering team, faith-based folks in my steering team, youth organizations, local government, nonprofits, you name it, very diverse group of folks. But through Big Brothers, Big Sisters, they kept coming back at me with, the children who have a parent incarcerated are 7 times more likely to return to prison themselves than the kids sitting next to them in the classroom. And I'm like, 7 times more likely. What if somebody could do something about that? And as the reentry work that I did, matured somewhat, I was able to go into the institution with some pilot projects that we created and interview men that were going to be coming back to our community, catch them 8 months before release, do an intake and an assessment and get a real good picture of what was going on with them, and then put things in place so that when they came out, they already had job interviews scheduled. They already had a psych appointment with a psychiatrist. They didn't have to wait 45 days and be off their meds before hopefully they got to a psychiatrist. Put a lot of those things in place. But the kids thing kept coming back at me. With the input and involvement of a lot of organizations, we put together a concept of a pilot project called the Parenting from Prison Pilot. And the concept is that we're working with moms who are still incarcerated for many years, some of them one life without parole, on improving their parenting skills. Improving a lot of skills as they relate to communication with their children and sometimes their grandchildren, and helping them become better parents, while at the same time working with their children in 24 communities throughout the state of Missouri, providing wraparound services for the child and caregiver there. And working with both of these pieces simultaneously, both the mom and the children and caregiver, and building and bridging through technology, communication to help improve the quality of the relationship that is there. And we've been allowed, because it's a pilot project with a limited scope, some freedom to use existing resources, things like the StoryLink project. But we've also been able to take that, and on the 12th and 14th of this month in Vandalia, not just doing audio recordings, but able to now burn DVDs and send a DVD message from the institution home. And in a lot of programs, that's the only way information is allowed to travel from the institution home. However, in this project, we're actually delivering that DVD through our community network to the child and or caregiver in the home, and make sure that the proper supports are in place, whether it's, a counselor from Pathways, or, it's different things in different communities, but there are supports there when the child and the caregiver get in front of that TV, and the kid may be seeing his mom for the first time since he can remember. Some of these moms are leaving infants behind. We actually have children that are born while their mothers are incarcerated. So it can be a big deal, and in the past there hasn't been the ability to work both with the offender mother or any offender fathers and their families. And in this project, we're able to do both. So in addition to the DVD recordings, we're also going to be piloting virtual visits. And it hasn't been established yet. It's been piloted twice. And we intend for it to become a part of this project as well, so that many of our kids are in the southeast, southwest Missouri, and their mom's in Vandalia. When you've got grandparents driving and it's a long trip, a lot of our grandparents can't drive at night, lots of barriers, lots of issues. It's not possible. Some of these kids and moms haven't had visits in 5-6 years. Some very challenging circumstances there. So through technology in the next year, we hope to be able to put in place virtual visits for the kids and caregivers in the community, as well as the institutionalized mother. We've got a number of partners in this project. We're working with University of Missouri Extension, with Big Brothers Big Sisters. I'm sure I'm going to forget someone here, but I'm going to take a shot at it. Working closely with StoryLink. A number of community action teams. The critical partner in this is the Department of Corrections. Couldn't possibly do this without them, and very pleasantly surprised in the early stages to find them very receptive to this concept, this new approach. Missouri Department of Social Services, very key player in this. The 4-H Life program through the Extension Office, very important piece. Lots of players in the steering team. But when we go to the communities and we work with the kids and caregivers, we're actually putting in place assessment tools to help identify what are the needs of the child and of the caregiver, and they're very holistic, approaching, what are your relationships for the kid, identifying if there's substance issues, mental health issues, are they getting enough food to eat, a whole holistic approach there, and putting a plan in place. Once we've identified the issues, one of the projects families we're working with is in the St. Joe area. It's going very well. They're identifying a number of social service, legal, faith organizations in that community to provide the wraparound services necessary for this child and this caregiver. In this case, a number of children and a caregiver in some pretty difficult circumstances, and helping shore up things there, make sure the kids finish school. 2 of the kids in that family this summer got jobs as a result of this project, got summer jobs. A lot of good resources coming into place in a very challenged family situation. So excited to see what's able to happen at the community level when all the players work together. We often find that senior services will have a case manager, caseworker. Family services will have a case manager, caseworker. The local food pantry might have something. Mental health provider may have something. They'll have somebody working with them from workforce development to try to get a job. But those caseworkers don't ever talk to each other. They work in the same buildings. They walk past each other to and from the bathroom, but they never talk about this family. And so there's not that integration of services, and that's what we're seeking and working to develop for these children throughout the state of Missouri who have a mother incarcerated. And we started this project in January of this year. with an orientation for these moms. And we're currently working with these moms. I was up in Vandalia all day yesterday, working with these moms, trying to iron out some of the communication challenges, things of that nature. A lot of these families, very transient, very mobile, hard to keep up with, hard to keep track of. But interestingly enough, and it was part of the reason we attached to Vandalia is, as a pilot to start, the moms usually know how to find their kids. They may not be able to talk to them, but unlike, and I'm generalizing here, many of the dads, the moms know where they're at through the networks that they have. And so we're able often to find the kids by circling back to mom. So the objectives of our project really are about improving the quality of the relationship between the child or the children and the offender mom, to concentrate on reducing this intergenerational cycle of incarceration, and to develop an integrated system of service delivery that addresses the parent-child relationship, working both in the institution and the community. Lots of pieces to this. It's a 2-year pilot. Nothing like this has ever been done in the country that anyone's been able to identify for us. We know it hasn't happened in the state of Missouri, and there's lots of reasons why it couldn't work or shouldn't work, but what we have is a lot of partners committed to making it work, who are willing to go that extra step and do the extra pieces necessary, put in the extra hours, the extra time. And I was asked earlier, shortly after I got here, where did our funding come from? Well, the project, for the most part, is unfunded. We started this project, putting it together on the 23rd of February of 2009. It was one of those aha moments for me. Got on the phone, started calling people. Folks quickly jumped on board and said, yes, we'd like to be a part of this project. They weren't coming because there was funding attached. They were coming because they had something to give, which is a very different approach to how business is done. I call it kind of the Stone Soup version. People were bringing, anybody that knows the children's book Stone Soup probably gets the idea here, but people were coming to put something in the pot to create something that didn't exist before. And so, with the exception of funding for a coordinator position for this project, which is partially funded by the Missouri Department of Corrections, there's no other budget. So the work that takes place in the community is through volunteer networks, through the community partnerships, through the organizations that are attaching to this project. We knew coming out with a $500,000 request in today's economy wasn't going to fly. And furthermore, what if we did get funded, we got the project off the ground, and the funding was yanked? So we built kind of a recession-proof approach to doing this business, believing that really what we needed was the organizations working together and to provide that connectivity using what's already there. So, I think I'll hand it off.